Last year has been something that we could not have imagined or believed. The COVID-19 pandemic has changed so much and taken far too many too soon. We've seen that Black, Asian, minority ethnic people are disproportionately affected, and it's great to say that there is hope and light at the end of the tunnel with this vaccine. I'm really looking forward to getting mine when I'm called in turn, and today I'm delighted to have Dr Harpreet Sood, board member of Health Education England and a global digital health advisor. Dr Sood, welcome. So tell me, what is a vaccine and why do we need them?
Thank you, Rena, and thank you for inviting me. So look, really excited to be here because I think it's a really important message that I would like to put out there. Vaccines are very, very important because what they do is they can protect ourselves and our children against ill health. And we've had vaccines for many diseases before, infectious diseases. So whether it's diseases like smallpox, polio, tetanus, measles, we all had them, and our children have all had them. So I think this is a real opportunity to say that for these infectious diseases that can cause harm, we have an opportunity to use these vaccines to build our own immune systems that help create these antibodies that protect you from these diseases. And the same applies with COVID. Then that it's much safer for your immune system to learn this through being vaccinated than catching the disease itself and treating it. And that's what's really exciting in the fact that we've, in the space of 12 months, got a COVID vaccine so quickly is remarkable to science, but remarkable achievement. And now what we're saying is that this is an opportunity for us to take this vaccine as many people as possible so that we can help your body build these antibodies to protect you from COVID.
Have you had the vaccine?
Absolutely. So I've had the vaccine, and I've been as a healthcare worker. I was, in the early stages of it. So I had the Pfizer one, if people are interested, and but all the vaccines that we are using in the NHS are safe, effective, and highly regulated. And I think that's the important consideration, is that one is not better than the other. I mean, they're all very good because they've all gone through a rigorous process of science and being tested and being approved by an independent regulator. I had the vaccine and I didn't experience any major side effects, except that with the Pfizer one in particular, I developed a very, very mild ache in my body. And so how I counteracted that was by taking 2 paracetamols, resting for a few hours, and we were back to normal. Nothing more than that. And if I then look at my parents, who both had the AstraZeneca vaccine, they've had no symptoms at all. And they're both in their late 60s, early 70s. So I think it's safe and effective. And we are seeing that very, very, very minimal side effects are being reported on the whole, which makes this even more exciting in the fact that we have this vaccine.
That's fantastic. And you've said before that we have developed this vaccine too quickly. Some people are saying it was developed too quickly. So how can we really be sure that it is safe for us?
Yeah, so like I said, firstly, it's really important to know that even those vaccines have been developed quickly, they've been highly regulated. And there's a number of enablers that happened that made this process quick. And I think, let me just touch upon 3 of those, right? The first is that the different phases of the clinical trial were delivered to overlap the process rather than run sequentially. So what I mean is that we were not waiting for one to finish before the other process was started. There was a lot of overlap, which really sped up the clinical process. So that's kind of the first thing. The second is there was a rolling assessment of the data that was being sent to the experts and the independent regulators at MHRA. And what that meant was that they could review the trial data as it was coming through, ask questions along the way, and request extra information as it was coming. And so what that meant was that, they were approving as we were going along, which again, really, really sped up the processes, because historically, when you go through that, it takes a lot more longer to do that because you're waiting for one thing after another. And the third thing, and I think this is the most important thing, is that one of the biggest challenges when you have with vaccine development is recruiting participants onto clinical trials. And because of the global effort that we've had, and because a lot more people have been very interested, the recruitment was very, very quick. And that meant thousands of people were able to volunteer very quickly, which meant that we were able to test these vaccines. So if you bring that all together, that's what's led to the speeding up of the process overall, which would have taken multiple years rather than the 12 months that we've seen. And I think we should be celebrating that because it's a really, really unique moment, which will then also set the standards for future vaccine developments, which is what now is being talked about.
I think this is the first time we've ever seen, scientists who normally would be working against each other coming together or
Absolutely.
not against each other, but trying to get to the goal first. They've been working together and
Exactly. Collaboration, working in harmony, working to support one another. I mean, all these good principles and behaviors have all come together, in a really timely moment. And I think that's what makes this hugely exciting.
so I think that what we're saying is that nothing has been skipped, nothing has been, everything has been done. We've had rigorous testing and we know it's safe.
Absolutely. And on top of that, I must say that, everything has been transparent. So all the data is publicly available. Everything's been published in really highly rigorous scientific journals, and it is all out there. And if you go on the government website, if you go on MHRA, you can get all the information on there so that people can rest their minds. And that's, again, the strength of the science that we have that's developed this vaccine.
We've seen a lot of information coming through WhatsApp and other kind of email and social media channels that say that the vaccine is not suitable for vegetarians or it's not vegan. Is it suitable? Is it halal? Is it suitable for vegetarians and vegans? Are there any kind of things we should know there?
It is absolutely suitable for both vegetarians, but also the fact that it is fully endorsed by all Muslim leaders and the religious councils that have looked at it and have suggested that from Muslim perspective that it contains no pork products. And I think that's really important. And organizations and faith leaders and community leaders are encouraging their communities from that basis to take the vaccine. The British Islamic Medical Association, Islamic Medical Association is one of the number of Muslim organizations that have been encouraging people to take the vaccines. The Oxford AstraZeneca, again, vaccine is acceptable and it's been endorsed by all Muslim scholars who are saying that it's absolutely okay to take it. And I think that, again, is a strength of being transparent but being open. And the same with from the vegetarian perspective, in that there's no animal products or anything else to be concerned about because of the ingredients used, and on that basis been endorsed by religious and cultural reasons by religious leaders.
Excellent. So it is suitable for all vegetarians, it's suitable for vegans, there are no animal products. And just to say that again, I think because we can't emphasize that enough, especially with some of the WhatsApp messages. Does the vaccine contain any aborted fetal cells?
So there are no aborted fetal cells or tissues in any of the COVID-19 vaccines. In fact, there are no living organisms or human cells in any of the jabs. And I think I must reiterate this, that the production and testing of each vaccine has been monitored to ensure they meet the highest of ethical standards. Because we have been asked this question before, and again, it's important to reiterate that. And like I said earlier, Muslim associations, imams, religious leaders, community leaders, faith leaders have all endorsed the vaccine rollout and the ingredients and the fact that they are safe and permissible for all these communities.
So some are saying because there were no pregnant women involved in the trials, it's unsafe. Is that true? Could you shed some light on that?
So that's not literally true. I think what the guidance is that we are given, and the Royal College of Obstetrics and Gynecologists are also saying, is that it's important to weigh the risks versus benefits on that front. So it's usually best practice for pregnant women to be excluded from clinical trials for new medicines and vaccines, and that's usually because of a precautionary measure, not because they are proven risks. And because the COVID-19 vaccines have not been yet tested on pregnant women, it's not saying that it's not allowed, but it's saying that we have to weigh up the risks versus benefits. And that's why I think it's something that is, do speak to your GP about it if you are unsure, depending on your role, your risk factors, and all the other things that are happening versus what the benefits might be. So it's not a complete no, it's more about weighing up the risks and benefits for your individual situation.
It's about best practice, which, as you've said, is for pregnant women to be excluded from clinical trials. Does a vaccine modify your DNA?
Again, absolutely not. So I must say that the claim that the COVID-19 vaccine modifies your DNA is false. The vaccines do not interfere with your DNA, and it's a myth that seems to have spread widely because of the mRNA vaccine aspects of it, but because both the Pfizer and the Moderna vaccines are mRNA, and that has nothing to do with your DNA, and it doesn't modify your genes. But what it does do is trigger a certain reaction in your immune system that causes your body to produce proteins which can fight later the virus.
Which could potentially save your life and ensure that you don't have a very bad reaction if you should catch COVID.
Absolutely. And Rena, I just want to also pick up on that. It's not only is it saving your life, but it will also save your loved ones and the community around you. And I think that's the important thing here, is that this is not just the individual benefit, but also benefit to your society and your community.
Dr. Sood, there are rumours that the vaccine can make you infertile, or the vaccine could give you COVID. So are either of those true?
So, and look, there have been some harmful myths circulating that claim that COVID-19 vaccines can make you infertile. And the answer to that is it's not the case. Again, that's been circulated, and we even saw some recent evidence that suggested that there's no impact on fertility. And in terms of giving you COVID, again, you can't catch COVID-19 from any of the vaccines that have been approved in the UK. What they do is they work by stimulating your immune system to produce antibodies, which are like these recognizing cells, essentially, that if you're exposed to the virus in the future, your body can then fight it. So you could test positive after having a jab because you've caught the virus before receiving the vaccine, but not because of the vaccine. And, you know, this has been highlighted before, and I'll say it again, but no vaccine offers 100% protection, right? And it is still possible to get COVID, but the vaccine gives you a much better chance of being protected against it, but also protecting others.
It gives you a better chance of fighting COVID if
Absolutely.
you should. Do the vaccines contain any chips to track us or track the population?
No. And again, I must say that none of the COVID-19 vaccines contain any microchips, and they cannot be used to track you. And again, you know, I won't go into the detail, but again, what it is doing is teaching your immune system to develop the antibodies, but it's nothing to do with tracking, and they do not contain any microchips.
If you want to track your family members, you've got to download an app and do it in the normal.
Exactly.
Not vaccine is completely safe, just protects you, does not track anybody. Dr. Sood, I'm young and relatively low risk. So do I need to take the vaccine?
Yes, I mean, look, it's certainly recommended, and this is what I would recommend as a GP is to get the vaccine. Okay, but let me just put in context is that, you know, elderly people, those with serious underlying health conditions, carers and healthcare workers have been prioritised in the UK vaccine rollout. This is because these groups, you know, have been identified as facing a higher risk of catching COVID-19 or experiencing complications from the virus itself. So young people, even though you say you're low risk, or young people feel that they might be at low risk, the vaccine can still offer you protection from the most serious complications and symptoms of COVID-19. And so the recommendation would be, when given the chance and when your turn comes, do take the vaccine, even if you are young and at low risk.
Thank you. And we've seen so many new strains of the virus. Will this vaccine work against the new strains?
Well, look, so the current advice and guidance is that it is effective against the two strains that we've seen in the UK, with possibly, you know, still being worked up with the South African strain that we are seeing. But, you know, I guess this is a space that we'll see how it plays out. I mean, there's no evidence that currently suggests that new strains will be resistant to the vaccines we have, but we are continuing to vaccinate people as normal. Scientists are continuing to look at all the detail and the characteristics of the virus in relation to the new vaccines, but also the variants. But again, like the suggestion was made, there may well be a possibility that there is a booster of some sort or something similar that may come later this year. But at this point, there's no evidence to suggest that they do not work against any new strains.
I have to ask, is one vaccine better than the other?
So like I said, they are all safe and effective, and they all have very good safety and efficacy. The most important thing is to get vaccinated rather than being worried about which particular vaccine you have. Again, if I can use my personal example, I've had Pfizer, my parents have had AstraZeneca, my brother's had Pfizer, who's also a doctor. So we have just been very excited that we've had the opportunity to get the vaccine, because like I said, anything that's gone through the rigor of being tested, but also being passed by the independent regulator is going to be safe and effective. And I think that's what we need to be concerned about.
And when we are given the vaccine, or when my turn comes, will I be given the same vaccine for both of my doses?
Yeah, so at the moment, the recommendation is not to mix the vaccines. So if your first dose was Pfizer, you would get the second dose being Pfizer as well, and the same with AstraZeneca. So yeah, so that's the case at the moment, and the guidance is clear, and every effort is being made to make sure that is happening for now. Yes.
And once one has a vaccine, can you return back to normal, start mixing with friends and family, partying, all the rest of it?
Well, look, eventually that might well be the hope. But again, like the Prime Minister said yesterday, this is going to be about data rather than dates. And at this point, it's about looking at, how effective is the vaccine at preventing transmission? How effective is it to, at what level of the population we need to get it at to make sure that we develop that kind of herd community impact. So that's still work in progress. I believe that there will still be some social distancing, but if we were to ease lockdown restrictions on the 21st of June, then there might well be the opportunity to do some interaction. But I think this is still work to be in progress, depending on how the next few months play out with the vaccine rollout and anything else that may get curveball that might come our way that we haven't predicted.
So what I'm hearing from you is that the vaccine is very important. It's, the one thing that we can do to protect not only ourselves, but our families. And we've had vaccines throughout our years growing up. We've had smallpox, MMR, things like that. And this is the light at the end of the tunnel. And if we don't take our vaccines or takes this vaccination, it's possible that we will see this awful disease spread again quickly.
And absolutely, and I think, like I said, vaccine is one element of it. We still have to maintain and follow government restrictions and advice. And at this point, it is to say that we still have to carry on with in our immediate situation lockdown restrictions. But even with things open up, if the guidance is saying that we need to maintain social distancing, then that is still going to be the case because it may take a while before we completely suppress it. So vaccine is certainly a boost and a hope, but it's not the magic bullet that will mean everything goes back to normal. I think that will come with time.
So all these messages that we may wake up to on our phones in the morning, if people have questions, I personally think if haldi and kalonji seeds could cure this, we would have been saving a lot of people a lot of energy in trying to fight the virus and saving the NHS a lot of money. But all these messages, if we have any questions and we want to know the truth or get answers, who should we call? Should we call our GPs?
Absolutely. I think that would be one safe option, is to call your GP if you're unsure. Obviously use, if you have the ability to go online and use online websites or links, make sure you use government websites, so nhs.uk or the UK government website. Those would be my two opening points to suggest. And obviously, community and faith leaders are fully endorsing this, so there might be an option to go there and ask for any information. And if in doubt, don't believe what you just get sent or what you read, because there is a lot of information out there. There's a lot of misinformation out there, and I think that's causing a lot of people to make the wrong decisions. I think this is, for me as a GP in particular, it's about making sure that people have the right information to make the decision rather than the wrong information, and our job is to give people that right information. So GP is your first port of call, community pharmacists, UK government websites, NHS websites, community and faith leaders. Those would be my options. And hopefully you can access one of those to get the right information.
Dr. Sood, thank you very much. You've been very, very helpful. This is Rena Ranger waiting for her vaccine, talking to Dr. Harpreet Sood, who has been vaccinated, about the COVID-19 vaccine. Thank you for your time.
Thank you. Good evening.